If someone has a brain tumor, their life suddenly changes. The way they think themselves that they're not there tomorrow, what happens to themselves and to their family always comes into the mind. Believe it or not, we have moved on significantly well to make sure the patients will do well, his future is well secured, and his family will be well taken care by himself rather than anybody else. Then how is it done in Aster Whitefield? So I get at least about 6 to 7 brain tumors a week. So when you use the newer technologies and when we make the patient to understand what exactly happening to them, I'm sure all their apprehension falls into pieces and automatically they start cherishing their whatever their life they have at that moment. So how do we do it? The first thing is our great communication to tell the patient that brain tumor, nobody knows why it happens. It can happen to even me or to anybody around me. So the first apprehension goes, why only to me from the patient's aspect. Second, when we investigate with them with the high-end MRI, where you can see the whole picture of the brain tumor in 3-dimensional picture, we adapt the same MRI picture into our new technology called as virtual reality and augmented reality, where I can show the patient his own brain, his own tumor within that brain, and what is the relation between the brain and its structure around it. Where is his hand area, where is his leg area, where is his speech area, which many of the patients will be thinking if they do the surgery, all those things get destroyed. All the things I can predict and show them using this newer VR technology, and the patients become much more calmer saying that, they are in good hands. In addition to that, when I make them to talk to another patient or another example of the video which I shown operated recently, how the patients, doing post-surgery or how their family, interacting with the patient, to give them more confidence, their confidence boosts. So it is not only pre-operative, even during surgery, we have adapted a technology where it's called awake craniotomy. That is where patient is not anesthetized. Patient will be talking to us. Patient sometimes will be visualizing his own movie, or when we give him the instruction, he'll be talking to us. In fact, some of my patients will be singing when they operate. So when they're conscious, and only the area which we are operating, we anesthetize that area. And they'll be more confident that I'm in constant communication with them, and they're safe because they keep on moving their hand, talking. That also boosts their morale. So during surgery, when we do this surgery, we also mark his important areas like leg area, hand area, social areas which are required for day-to-day living, so that we preserve all the areas and we remove only the tumor to make sure he's completely intact at the end of the procedure. And many of these patients, when we do the awake craniotomy, believe it or not, they get up as though they had a fresh coffee and walk immediately after we stitch the skin, and they walk to their own bed. That increases their morale significantly. And post-operatively, once again, with the use of the VR technology, when we do the scan, we show their pre-operative MRI and post-operative MRI pictures with VR with a 3-dimensional pixelation. Then they understand that the tumor is gone. Believe it or not, their ecstasy is completely different. And with the pathology, what comes in, 90% of the tumors usually will be benign, and 10% of them will have abnormal things, which also can be taken care with new radiotherapy, new chemotherapy, and with our own tumor board, which is considered one of the best with our own oncologists and radiotherapists. When they talk to them empathetically, saying that we will handhold him to every aspect of his apprehension, patients become very, very calm. And this is what is the modern day of treatment, where empathy first, technology next, and surgery remains the mainstay. There is nothing to scared of if you have a brain tumor. What is required is perfect diagnosis, expert team members who are handling you, and how you are come out of the surgery with smile, with a normal intact neurology, and how you are taken care post-operatively makes the difference. So if you have a brain tumor, never get scared. Visit Aster Whitefield Brain Tumor Center.